Hi, my name is Dr. Diane Klein-Ritter.
And I'm Dr. Jennifer Hensley.
And we're internal medicine physicians based in Stony Brook, New York. Welcome to another episode of ACP's Physician-to-Physician Conversation Series. Today's discussion is best practices for managing COVID-19 in the outpatient setting. A challenge for our practice was how to provide a safe and comfortable environment for our vulnerable patients who are in the office for their annual wellness visits or follow-up of chronic medical conditions, as well as care for patients who are possibly infected with COVID-19. What do you do if a patient calls your office with suspected COVID-19?
Well, the call is directed to our nursing staff, who then triage the severity of the symptoms. If COVID is suspected, we asked if they're able to test from home. If they do test positive, then we do offer a telehealth visit with either a physician or a nurse practitioner to again assess the severity of their symptoms and to offer treatment options. If they are unable to test at home, then we do offer testing in our office prior to the visit, and then again we will triage appropriately according to their symptoms and their needs. During a telehealth visit, medication interactions are reviewed. We review their underlying medical conditions, that we look at their kidney function and prescribe appropriate medications. If they test positive, we recommend appropriate treatment such as antivirals based on the risk factors.
Our nursing staff is our biggest resource. They triage patients and assess if they're too sick to be seen by telehealth. Before their appointment, they educate the patients on how to care for themselves and isolate appropriately. Prior to infection, patients are educated at their routine visits about COVID symptoms, available treatment options, and vaccinations. We recommend patients and their families stay up to date on their COVID and other vaccines. We work to stay up to date ourselves with current guidelines by having periodic staff updates by infectious disease specialists on outpatient management and monitoring CDC guidelines. As we became more experienced, we became more comfortable with the potential risks and benefits of available medications, and we're able to communicate this more effectively to patients.
For current recommendations and helpful resources, please visit the ACP Adult Immunization Resource Hub. It really takes a team to manage your COVID patients. Between calls that come into the office, to our front staff, to our nurses, our LPNs, NPs, and physicians. Each one has been delegated a role in the process of how to take care of these patients. The call center quickly gets the messages to our triage nurses on the initial calls, and we really work hard to respond quickly to these patients that could be in distress. If they are actually coming in ill into the office receptionists and medical assistants quickly isolate people and provide masks or anything if there's concern for possible COVID symptoms. We also tried to make things a little bit more streamlined, help with time management, such as creating a standard template for our nurses used to assess these patients in a quick and timely manner.
That's all we have for today's episode of ACP's Physician-to-Physician Conversation Series. We've provided a few links in the description to resources to help you manage COVID-19 in your practice. And be sure to subscribe to ACP's YouTube channel for more videos.